Hi guys, it's Dr. Parth Palan here, and I am doing my DNB Ophthalmology from LV Prasad Eye Institute, Hyderabad. And now that your NEETPG counseling has finally begun, many of you are confused whether you will be getting your branch of choice, whether you will be getting your hospital of choice, and the most important confusion and dilemma is whether you should repeat NEETPG or not repeat. So, my advice to all the NEET PG aspirants is not to repeat, or at least keep repeating as your last resort. Because repeating, putting 1 year of hard work, 1 year of commitment, 1 year of sacrifice is definitely not an easy job. It is very, very difficult. And the most important thing that in such a highly competitive exam like NEET PG, there is no guarantee that at the end of 1 year, that is the next NEET PG, what your rank will be or in what situation you are going to be after 1 year. So in this video, I am going to give you a few options which you can consider before going to your final resort, that is repeating. And these options are not new, and I have been seeing many aspirants choose these options and taking a decision to not repeat. So please take this very, very seriously, guys. But before starting, if you have any more queries or if you have any more doubts, please feel free to connect with me on Instagram. My Instagram ID is palanpath03. I would be really happy to solve all your doubts and queries. So here begins. Number 1, opting for a DNB seat. I have made a whole set of videos on DNB degree, that is what is DNB, how is it different from MS and MD, and what are the disadvantages and the advantages of a DNB degree. So all of those videos are concise in my playlist, which you can click above, and please watch all those videos to know more on this on DNB degree. And here, let me just concise everything about the DNB degree. It is recognized by the National Medical Council. It has really good academics. It has no bond. The fees is very much regulated, and few of the DNB institutes have very good surgical exposure as well. So what are you waiting for? Why are you not considering DNB in your options? See, I totally agree that there are quite a few DNB institutes whose academics is not at par, but for this you really need to do your own R&D. You need to do your own research. Please contact residents, contact seniors of that institute and ask how the DNB Institute is, because right now I'm doing DNB Ophthalmology in LV Prasad Eye Institute, and DNB Ophthal is definitely better than MS Ophthalmology. So you need to do your own research to know this. Number 2, MS or MD in a private institute. So guys, if finance is not a problem for you, I highly recommend this option. See, because repeating is 1 whole year of sitting at home, doing nothing, not getting any income, only and only studying, sacrificing everything for that one exam. And for what? The exam of uncertainty, you don't even know if you will be able to crack it in the next attempt. So instead of that, if finance is not a problem, why not take up a seat right now, study for 3 years, and then repay it to your parents in your initial years of practice? I definitely think this is a very, very logical option. And रही बात लोग क्या कहेंगे? लोग क्या ही कहेंगे? See, at the end of the day, that is after a few years, nobody really cares. If your basics are right, if you are a good doctor, if your concepts are logical, I think all the patients are going to salute you for who you are. And nobody is going to ask you कि आपने कहाँ से किया? Have you done from a government institute or a private institute? So guys, this is an option which you really should consider. And lastly, point number 3, change your branch. To be very honest, I was absolutely against this point before applying for my own NEETPG counseling. I was like, how do people even do this? You commit to something, you commit to a branch that मैं तो यही करूँगा, and then after maybe a few months you are like, नहीं ये भी चलेगा. So I was totally against this. But then eventually I realized that this is not a bad option at all. See, there are a few people who have committed to one branch from the beginning itself that मैं तो यही बनूँगा. So this option is not for them. But there are quite a few aspirants, who have 3 to 4 branches in their choice. That ठीक है, ये नहीं तो ये सही. So for this, what you all need to do right now is you not only need to talk to your senior, that is the residents, but you also need to go around looking at a few doctors. I mean, at the end of 10 years or 20 years of practice, how exactly are they faring right now? What are the disadvantages? What are the advantages? How much money they are making? What is their income? And after looking at all these things, only then you will be able to decide that is this branch okay for you? Will you be okay taking up this branch? Will this branch maybe satisfy you? The most important point I'm trying to make here is that there should be no ego. That no, I had told my friend, I had told my family, I had told everyone that I'll become a cardiologist only. So no, now I'll have to take up MD medicine and I'll have to take up NEET SS cardiology branch itself. So no, there should be no ego. You need to have all your options open and you need to be very logical while choosing them. So this is it from my side. So please consider these options, guys, before going to your last resort, that is repeating, because repeating is definitely not easy. So yeah, like I had said before, if you have any further queries or doubts, please feel free to connect with me on Instagram. My Instagram ID is palanparth03. And in the end, all the very best, guys, for your NEETPG counseling. I hope you do get the branch of your choice and the hospital of choice as well. Kill it!